So you can now scale this therapy exponentially, as only digital things can do, and the marginal cost of delivering that heads towards zero. You know, I can see now why investors prefer second or third time founders, because first time, man, it's so hard. It's kind of a miracle we're still here, but because we are going to have to fix this healthcare system, it's not sustainable the way it is. In that kind of a world, digital therapeutics make absolute sense, and you can start to demonstrate the value and then capture some of that value. VR just keeps getting better and better, and there's a lot more exciting stuff ahead.
All right, welcome back to the Middle Tech Podcast. You've got Logan Jones here with Evan Knowles. Today, we are joined by Aaron Gani. So you might recognize Aaron from episode 150 when he came on to talk about BehaVR. So we wanted to have Aaron back on for this episode because BehaVR has recently, as of November of 2023, acquired Fern Health and formed RealizedCare. So it's a pretty significant transaction. So we wanted to have them back on to talk about their journey, building that company, BehaVR, and then ultimately forming RealizedCare alongside Fern Health. So before we get into that conversation, we just want to get a quick word from our sponsors. Before highlighting our sponsors, we'd just like to state that the views and content shared on this platform do not necessarily reflect those of our show sponsors. Middle Tech is presented by KY Innovation, the Kentucky Cabinet for Economic Development's Office of Entrepreneurship. KY Innovation exists to support and develop Kentucky's startup ecosystem, and we are proud to be supported by an organization whose mission aligns so closely with ours. If you're a founder building in Kentucky, you need to check out the resources that KY Innovation has to offer. You can find more information by clicking the link in our show notes or going to kyinnovation.com. Middle Tech is sponsored by Bolt Marketing. Take your website to the next level with a website that's built to work. At Bolt Marketing, they're revolutionizing websites for small businesses that are affordable, customizable, and hassle-free. Whether you have a construction company, a boutique clothing store, or you own a hot yoga studio, they have options for you. Click the link in our show notes to explore their marketing options that can transform your marketing and grow your business. And as a personal note, Bolt Marketing built our website, and they were awesome to work with throughout the entire process. We highly recommend working with them. Middle Tech is also supported by Huntsicker, an impact venture studio based in Lexington, Kentucky. Huntsicker is creating companies out of the ordinary by founding and funding the next generation of purpose-driven startups. They partner with founders to create indispensable solutions to the world's most fundamental problems. On a quarterly basis, they host an invite-only intimate gathering called Fireside Convos, where attendees representing a wide network of stakeholders in the regional entrepreneurial ecosystem discuss timely topics, including the role of AI for startups out of Kentucky and the challenges of identifying and attracting talent. To be considered as a guest, visit huntsicker.co/fireside to apply. All right, Aaron, welcome back on the podcast. I was just saying in the intro there, we last had you on for episode 150, which was, I believe, almost 3 years ago now, back in June of 2021. Lots has gone on for both of us since then, so we're super excited to have you back on the podcast. Welcome back.
Yeah, thank you. I'm happy to be back. Congratulations on all the progress, guys, and you're still going strong. What episode is this?
Yeah. This is 282 that we're on currently. So we've managed to stay consistent with it. We're proud of it for sure.
You should be.
Yeah, absolutely. Well, cool. So like I said, we've had you on the podcast once before. I'm sure many of the listeners remember that episode. But for those that are new to you and BehaVR and RealizedCare, let's just start off with going over a quick refresher. So we'll start off by getting a quick refresher on you and your background prior to starting the company. And then we'll talk a little bit about, the problem that the company was solving and is solving.
Sure. So I've been a tech guy my whole life, from childhood and all of my professional days. I was in financial services for many years, and then in healthcare since 2006 when I joined Humana, where I was for a dozen years. It was a great place to learn about healthcare and, loved my time there, but ultimately decided I had to strike out and try and build my own business, and founded BehaVR in 2016. Gosh, I can't believe it's been 8 years and a long journey. But as you said, late last year, we did a second acquisition and rebranded as RealizedCare for some reasons I'll describe maybe as we get into the discussion. And what we do fundamentally is we digitize evidence-based therapies. So in the industry, we call this digital therapeutics, where you take proven evidence-based clinical protocols, digitize them so you have something that's engaging and effective, run them through, randomized controlled trials, clinical studies, There are regulatory frameworks with bodies like the FDA here in the US or NICE in the UK and so on. And so ultimately you can prove that these things are, you start with something evidence-based, but you prove that your translation of that into this digital form is, of course, safe, but also ultimately effective. So you can now scale this therapy exponentially, as only digital things can do, and the marginal cost of delivering that heads towards zero, which is pretty amazing. In healthcare broadly, and especially in mental and behavioral health, there are not nearly enough human clinicians to meet the demand. And so we ultimately need this kind of innovation to improve access to care and smash through all these barriers to care and the high cost of care and the problematic economics of care. So that's what we've been about really since our founding. We've evolved a little bit and learned about how to do that better. And then in latter years, really how to go to market. And we're operating here in the US and the UK. But that's the trajectory that we've been on.
So what patients that are using your care and your technology, what are some of their illnesses, disabilities, or problems that they're facing with their health?
Yeah, so our most mature product is for chronic pain. And that is related to why we did the Fern Health acquisition. And maybe I'll come back to that in just a moment. But so chronic pain is where we started. And then we have programs for social anxiety disorder, opioid use disorder in the pipeline, generalized anxiety and major depression in the pipeline. And then in the UK, we have our Game Change product, which addresses severe agoraphobia in patients with schizophrenia and psychosis. So this is folks that it's not mere social anxiety. It's like they're really afraid to go out of their house or ride the bus or engage with society. And so, we work in virtual reality, in terms of our therapeutic programs. And the reason we do that, it's particularly effective. We sort of boil it down by saying addressing fear and pain. And so the fear side, you can do digital exposure therapy, put people into this multisensory simulation, putting them in the presence of the threat for them, right? So if you think about agoraphobia, it's literally practicing like going out your front door and somebody walks by on the street and makes eye contact and, working through that. It's called inhibitory learning by psychologists, but sort of helping you through identifying how you feel, what are your safety behaviors, abandoning those safety behaviors, and so on. So exposure therapy for addressing fear. And then with pain, there's some very powerful analgesic effects of this immersive VR environment. And we also create gamified exercise and movement and do pain neuroscience education and calming and mindfulness. So broadly fear and pain related, but you can think of it as anxiety, depression, pain, opioid use disorder, and then, as I mentioned, agoraphobic avoidance. And there's other things we could do in the future. PTSD is a very promising area, but we're still a small company and we can't do everything at once. So,
yeah. And, just to share some of my own experience with this, I have one of the VR headsets, the Oculus Quest, I forget exactly which one it is. And I got an app on it that it was essentially a meditation app. And the way, just to describe it for people listening, it puts you in this like very calming setting, and then it has things that you follow with your eyes. And the combination of those two things alongside the sounds that it plays, it really, when you're talking about it, it's hard to really picture what it's like if you've never done a VR exercise of some sort, but you really can become fully immersed in something that brings a very calming feeling and a very meditative state in the case of the application that I was talking about. So, I mean, I can visualize exactly kind of how you guys are doing what you're doing, and it makes a whole lot of sense. And something you mentioned at the beginning there that I think would make sense to go ahead and start digging into is the reason for acquiring Fern Health. So let's start going down that path and talking about the acquisition itself and why that made sense at the time that it did.
Yeah, happy to. So as we've discussed, we've been building these digital therapeutics now for years. And with chronic pain and with Game Change, our agoraphobia program, we're in market. And there is a fundamental challenge with digital therapeutics, which is they're quite new, sort of this net new category of therapy. And so the healthcare system, including clinicians, by and large, they're not familiar with them, right? So it's not top of mind for clinicians, whether it's doctors or psychologists or whoever, to think about deploying these. and reimbursement structures are not in place. So like here in the US, there is no reimbursement category for a digital therapeutic yet. Literally from the Social Security Act and through CMS, Medicare, and Medicaid, where most commercial payers take their, they tend to replicate what CMS does. There's no category. They can pay for hospitals, they can pay for, facility charges, drugs, medical devices, obviously human clinicians. Digital therapeutics, not a category. So we're working on that as an industry, and with advocacy in DC and so on. But here's the point. While that is still the case, while the system is not yet fully up to speed on what are these things, how do you deploy them, how do you sort of capture value and get them paid for, you need other paths to market. And so what we decided to do about a year ago, having, really served thousands of patients in clinical settings, we had some traction, but we needed something more scalable. And so we said, we're going to wrap the therapeutics in something that looks more like what the system recognizes. And that specifically is care management, right? So I can go to an employer or a payer or even a provider that's at risk, like value-based provider, and they may not have ever heard of digital therapeutics or care about VR at all, but they do care about identifying high-cost populations that they're looking after, right? Whether it's employees or members or patients, and using analytics to identify them. We'll do outreach to engage them. We'll get them into our program. We provide coaching services in case they need help sort of around the edges. And then the goal is to improve their health and save money. And that is something that resonates better in the system. So when we decided to evolve to that, to say, let's put our digital therapeutics inside of like a digital care management program, that's when we went after Fern. We had gotten to know Fern for a couple of years. I knew their CEO and their parent company, Grunenthal, which is a German pharma company. We had been talking to them about maybe working on digital therapeutics together because Grunenthal is all focused on pain. And that hadn't happened. Just timing wasn't right. But we went back and said, hey, we think that Fern is very complementary to what BehaVR has, and then, which is true. And then with this sort of repositioning of our value proposition, still digital therapeutics at the core, but a different way to go to market and say, this is what we do for you, payer, employer, value-based provider. We thought that was also a good time to rebrand the company. So that's when we went and rebranded the company as RealizedCare.
Yeah, I'm curious about what it looks like to have something that is reimbursable and get to that stage where either the government or the healthcare system, providers, that they will recognize something, and then the insurance comes and reimburses it. So what does that process look like, and how do you navigate that?
Yeah, well, a couple of things I'd say. One is the US is lagging here on the global stage. So Germany is probably leading the pack. Today in Germany, clinically validated digital therapeutics are paid for by law. It's through a program they call DIGA, which is basically a German acronym. France is not far behind, nor is the UK, Japan, South Korea. Middle East is getting wound up. So this is a global phenomenon that with increasing sort of harmonization across the global regulatory frameworks. And like biopharma, we believe that if you're building clinically validated digital therapeutics and putting all this time and money in, you should take them to global markets. And so that's what we're doing. The US is a little behind. Our healthcare system is kind of unique and great in some ways and really dysfunctional in other ways. But there's a broader trend, right? Which is our system in general isn't working all that well. We haven't really bent the cost curve. We're still at somewhere around just shy of 20% of GDP goes to healthcare. The spending levels are unsustainable despite all of our efforts to fix that. And one of the somewhat slow moving but relentless shifts in the system is the move from fee-for-service care to value-based care, right? Where the payers, the sponsors of care, whether it's the government or a private payer or a self-insured employer, they say to the people delivering the care, I'm not going to pay you based on how much care you deliver. That's fee-for-service. I'm going to pay you based on outcomes and whether you make people healthier and save money. That's value-based care. In that kind of a framework, digital therapeutics suddenly start to make a ton of sense, right? Because if you guys are running a medical clinic and you're paid a certain amount of money to take care of that population, and let's say you're doing, primary care, that's called fully capitated primary care, you want the most scalable, most cost-effective ways to do that. Right? You're not motivated to just perform more services to get paid more. So in that, now that is a really sort of fundamental shift and trend in healthcare. It is slow moving. It doesn't happen overnight, happens more like over decades, but it is fairly relentless. And many people believe, and I'm one of them, pretty much inevitable, because we are going to have to fix this healthcare system. It's not sustainable the way it is. In that kind of a world, digital therapeutics make absolute sense, and you can start to demonstrate the value and then capture some of that value.
Yeah, that makes a whole lot of sense. I mean, just in terms of the scalability of it, you mentioned that at the beginning of, once you find something that's truly improving outcomes and you've built that system, the marginal cost of adding each new patient into that system just continues to drop and drop and drop.
Yeah.
And yeah, I couldn't agree with you more about our healthcare system seemingly being pretty broken right now.
Yeah.
I think that's on the minds of a lot of people as we see how much money the government's spending on that sort of thing.
Yeah. And Logan, just briefly on that, digitization, right? In most industries, it's already happened to a large degree, not in healthcare. Healthcare, it sort of surrounds care, right? It's like, oh, it's analytics, it's an EMR, it's a front door, it's scheduling, it's claims, whatever. But when you digitize the means of production in an industry, then things start to really shift, right? And that's what we're talking about. Not all of it overnight by any means, but significant chunks of actual care delivery and therapy become digitized. Wow, the scalability will be exponential. Marginal costs will improve dramatically.
Yeah, I'm glad you called that out, because the area that you guys are focusing on is truly digitizing it.
That's right.
Like you've said, kind of all the other technology being surrounding the healthcare space, there still has to be a human that's typically delivering care in almost all of those cases. But with what you guys are doing, you can truly drive outcomes purely through this VR platform and these interfaces that these patients interact with, which I think is a very important distinction, and also just very cool.
Yeah, there may still be humans involved, like our coaches, for example, but suddenly the humans who are there, they're surrounding the therapy as opposed to digital surrounding human therapy, right? So the economics just really fundamentally change.
Absolutely. Well, let's talk a little bit about the merger itself. So first question, you mentioned this is your second acquisition, which I don't think I was aware of the first one. So if you're able to share anything about that, would love to hear about that, but also just around, what you've learned about these sorts of transactions now going through two of them.
Sure. So the first one was in December of 22, we acquired Oxford VR, which is now our UK subsidiary. And Oxford VR was a spin out of Oxford University based on the work of Dr. Daniel Freeman, who is the chair of experimental psychology there. And Daniel still works with us now. He is literally world renowned for his work in paranoia, schizophrenia, psychosis. So he has this very deep, fundamental understanding of those conditions and what it's like to live with those conditions. And he was the co-founder of Oxford VR. Great company, amazing science, a little bit narrow, which is fine because it was, like a scientific innovation. And then in December of 22, after getting to know them for some time, we came together with them through one of their lead investors, Optum Ventures and Oxford Science Enterprises. So what we were doing was extending our pipeline, right? So we were already in anxiety, depression, pain, opioid use disorder. This was extending us up into serious mental illness. And we had very similar approaches in terms of how we used the medium of VR and how we thought about it and did design and so on. So it made great sense. That was the first acquisition. We still use the Oxford VR brand in the UK because it's Oxford and Daniel's really well known and it just works over there, right? And then the second one was Fern, as we discussed, which was very different, right? Because it wasn't just like another indication of a VR therapeutic. They didn't work in VR at all. They were more complementary to us with this digital engagement layer, more on your mobile phone, coaching protocols that they developed with Mass General Hospital, which is Harvard's teaching hospital, and this kind of care management layer. So it was very complementary to that shift in how we go to market. As far as, what did we learn? They're complicated. It starts with all of is there strategic alignment? Culture does matter. You don't have to line up perfectly, but you can't, where you don't line up, it does cause friction and then you have to work through that, right? So you want somebody that's like sees the world similarly and has similar values and, you got to work with these people every day, forever kind of feel to it. And just the process of arriving at terms and the lawyers and the bankers and all of that good stuff involved is time consuming for sure. It's expensive, so you bring capital in, but then a lot of it goes out too, because you got to pull that off. So you better have a darn good reason for doing it. I mean, that's what I would say. Neither of ours, because these are all sort of early stage companies. It wasn't, just some, inorganic growth, accretive revenue. Oh, they have $100 million business. Let's add it to our $1 billion business. Like just sort of simple math. It wasn't like that. It's much more early stage companies. You have to have a really strong strategic argument for why you're doing this. And then the other pieces have to fall into place. We also used both events to, strengthen our investor group and bring additional capital in. And so it was, opportunistic in that way, but we're really pleased with both. I mean, we're now at a place with Game Change in the UK. This was post-merger. We've now been through all of the regulatory regimes and frameworks in the UK. It's with the big pivotal study, it's approved by NICE for use in the UK. We've got UK CA mark and what they call digital, cybersecurity reviews and all the regulatory reviews. And it's go time over there. So that's pretty cool. And then with Fern, we don't have it all fully integrated yet because we just closed last December 1st. But we do have our strategy integrated, and we've integrated the teams and gone through all that. So it's all going pretty well.
Give us an idea of the size of the business now. So how many people are on your team across the world, and maybe just give us a sense of how they're spread out. So geographically.
Yeah, so we're still pretty small. I mean, which is kind of a good thing. Like I don't wake up every day thinking, man, I want to hire more people. It's nice to create jobs, but those people are expensive too. And so you try and hire really, really well. Just to be really candid, when you put companies together, you do also need to take costs out. So that's a very difficult and unfortunate part of it, but you do have to do that. And we've done some of that. We're at about 28 people right now. Still headquartered here in Elizabethtown. We have, 6 or 7 here in Kentucky, another center of gravity in Nashville. And then the rest are kind of all over the place, from Boston to Florida to Pittsburgh to California to Oahu and Hawaii. And so we're a little bit, in that post-COVID kind of very virtual world. I don't love everything about being so virtual. I kind of wish we were all in the same place, but it's not the world and reality we live in. So we're okay with that.
Yeah, distributed work can be hard. I think everybody has come to that realization.
Yeah, pros and cons, right?
Yeah, for sure. Now, I want to transition and briefly talk about the actual technology and form factor you're delivering this care, which is VR. I guess just kind of jokingly start. Have you used VR to work in a virtual office with your distributed team yet?
We've done that several times. I'll tell you, when I founded the company in 2016, then Facebook had just bought Oculus, right? Like a year prior. And the Oculus Rift, for those who are nerdy and really close to it, was just about to come out. We were all super excited about that. To be candid, I thought we'd be further along by 2024 in terms of adoption. So, I was too optimistic on that. But I think we probably all know the Bill Gates quote of like, a lot of people overestimate what they can get done in a year, but underestimate what they can get done in 10 years. Kind of, it's like that in this space, right? So there, a few years ago, there was all the metaverse hype and Facebook rebranded, and then it didn't take over the world and people, the metaverse is dead and VR didn't work. Actually not true. It keeps getting better and better and better. Like the Quest 3 from Meta, amazing product. I mean, if we'd had that even 3 or 4 years ago, let alone 8, we would have just been so delighted, so comfortable, such high quality experience, cost effective, mixed reality. It's just better and better. Just a few days ago, Meta announced that they are going to start out licensing their operating system, which they now call Horizon, to third-party makers. So they're sort of doing what Microsoft did with Windows way back in the day. And so Microsoft, as under an Xbox brand, and Lenovo and Asus have already said they're going to build their own VR headsets on that operating system. Of course, most people know that Apple entered the space recently with the Vision Pro, which is a very different product and still a little rough around the edges, even for Apple. but nobody's better at experience and hardware than Apple. So they'll eventually get that sorted out. So the whole space keeps getting better and better and more engaging. Have we hung out in VR and worked together? Yeah, we've done that with every generation of technology. None of it is good enough yet where we want to spend 10-hour days in VR together. With the Vision Pro, you start to see we may not be that far away, but we're not quite there. So VR is still for sort of intense, for most people, intense but limited periods. I actually do, what I mostly do in VR is work out with programs like Supernatural, which is, I won't even try and describe it. Just Google it. It's really cool. Supernatural VR, music and full body engagement. And I box in VR, which is a blast, fighting big bruising fighters in my basement. And it's unlike anything on a smartphone. You get your entire body engaged, right? So it's not just that immersive sense of what we call that presence, Logan, where you're can be really, really calming if you're in a calm environment, or really agitating if I put you in the presence of some threat for you. That's part of it. You're absolutely right. But then there's this whole aspect of it's full embodiment in this multi-sensory simulation, and your whole body's going. So if it's a fitness program, it's, dripping a sweat, full workout. That is not a thing that happens on smartphones. It's just not, right? It's not, it's a whole different world. What we do related to full body in our chronic pain program, a lot of people with pain, they have a lot of fear of movement. They've learned that when they move, they're afraid they're going to have a flare up and make it worse. So we help them overcome that fear with very gentle, gamified movement. We externalize their focus, and they're just playing games, and they're just following what we call ribbons. And there's different things that we have them do. And then we measure all that range of motion, and we start to show them look how you're actually able to do more than you thought. And then they progress right up through, whatever else they want to do. So VR just keeps getting better and better, and there's a lot more exciting stuff ahead.
Yeah, another VR experience that I like sharing with people that have either never done VR, a recommendation for people who enjoy VR. I got this game on mine called Super Hot. I don't know if you've heard of this. It's like the red figures that they're coming at you, and they're in slow motion. The faster you move, the faster they move. That was one of the first games where it had that kind of full body engagement with it. You're getting on the floor and you're ducking behind stuff and everything. So I think that's probably one of the use cases that not enough people really associate with VR, is that kind of that full body engagement with it. Cause it seems to me if you haven't played VR before, you still think of it as a video game platform of some sort. And you don't necessarily think of it as that full immersiveness.
It's also exceptionally hard to just describe. I've done it 1,000 times in 8 years, and people will be like, yeah, no, I think I get what you mean. And they don't until they get in it. And then they're like, whoa, hang on. What was that? That was a whole different experience. And so it's really hard to demo on a 2D screen over a Zoom meeting, but once people try it, they start to get it.
Yeah, I used to do this thing where I would let my friends and family try VR for the first time if they hadn't tried it, and I would video their reactions every time. And it's always so fun seeing somebody experience VR for the first time, because you're right. There's no way to describe it or really prepare yourself for that, because truly you've not experienced a digital experience like VR if you've never done it before. It's always cool to see people's reaction to that.
What we're doing, we're replacing literally your sensory inputs, right? And your brain doesn't have any way to deal with that other than this is real right now. That guy on box fighting, or that high cliff, or that action thing, or whatever it is. Or I'm sitting on a calming, beach scene and calming my, nervous system down, whatever.
Yep. And to transition this into kind of an emerging technology that I'm sure there's multiple routes we can take this down, which is artificial intelligence, and spatial computing, and kind of the combination of those two things. One thing, when you start using your imagination of where things could go when we have, things like Unreal Engine 5 combined with artificial intelligence, and essentially being able to create virtual worlds that you can interact with in VR. That's one use case here. But talk about, I guess, kind of two different paths for AI. One, in terms of how you guys are using the technology within your application. But two, we also spoke a little bit about how you guys are using it in the actual business to build the business. So let's explore both of those sides of it.
Sure. So one use is just, if you think about the value chain, all the production processes of our business, right? From from the clinical team using generative AI for reviewing and writing, clinical research and study protocols and so on, through the creative team. And this is our artists and experienced designers using generative AI to incredibly dramatically shorten some of their workloads on asset creation, as you were describing. Engineering, of course, most people that are paying any attention are seeing what's happening with like kind of Copilot, like, it's almost pair programming now with AI. And then right up through sales and marketing and generating campaigns and so on. So we use AI up and down. Literally, we've been like, in each part of the business, what are the top use cases? How are we applying it? That's on the, running our factory side. The other side, which is as exciting, more exciting, as we've discussed, Fern Health was about this engagement layer and coaching protocols and sort of supporting people around the VR therapeutics. We have built, and we're just about to launch, in essence, an AI version of the coaching. We're staying shy of clinical coaching. We're just going to take it a step at a time. We could do it, but we just want to make sure we're very careful and do a lot of testing. But we're starting with an AI coach for engagement purposes. So when you onboard to the experience, instead of just filling out sort of a very linear branching logic, many question survey so that we can understand you, you now have a conversation with this AI coach. Nexi is the short form. We may rebrand Nexi at some point, short for neural nexus, but you have a conversation with Nexi, and Nexi takes you through an interview so we can understand your situation, what's going on with you and what are your goals and objectives and where are your challenges. And you take all that in this very conversational interface, but then we're populating these incredibly rich data models, and object models about that member, which we can then use. We've done all this in our Azure cloud. And we use, by the way, a private instance of OpenAI, GPT 3.5 and 4 in Azure, all secure. So the data that we're processing here isn't, hitting public APIs of OpenAI or something. But we can use that for, in essence, tracking and understanding progression and nudging and bringing you back in. And then we will be providing that to your human coaches as well. So if I'm your human coach, I'll be looking at that platform and be like, okay, Logan, I see how you've been progressing, but I also know all these intimate, whatever you've told me, you're in this because you want to go to your kid's graduation or, what have you. It doesn't matter how rich or sort of subtle or detailed the information is. We've got it all. It's all sort of organized and thoughtful. And then we can use that for, as we've probably all experienced, very, incredibly empathetic and nuanced messages back as we want to engage that member. So it's really game changing in that way. And that's all sort of built out and final kind of prototype testing right now. We'll be turning that on really soon.
I think that's one of my favorite use cases that I've been thinking on recently as it relates to healthcare and treatment practices, is being able to really personalize a treatment to a specific patient, especially if you're using technologies like large language models to ingest all of this data about how somebody's interacting with one of these AI agents, and be able to also supplement that with a human in the loop, like one of your therapists. I'm blanking on the word you used for them, but I think that's the best use case for AI is being able to really provide that personalized care. So definitely, I think that's
one of the strong ones. And the other thing, it's not like, it's a chatbot. No, that's one interface, right? What it really is a whole model for understanding how to engage that member better. And it's multi-channel. So what we built here is it'll interact with you via SMS, and it can take chunks of our content and SMS them to you. Or it can be within the Fern app, which is more of a traditional app experience, or it can be inside the VR experience, because it's all basically abstracted. It's all in the cloud. And so we can have you interface, wherever you are.
One thing, and I'm sure it's very important, obviously, in healthcare, is, a lot of the worry around these models in high stakes industries is hallucinations.
Yeah.
Now I know the solve to hallucinations is very, can get down into the nitty gritty of the details of the technology, and in the weeds. So we don't need to necessarily go there, but how do you dampen that worry for anybody that has that?
Yeah, you have to be careful. I think a couple things, right? The somewhat obvious things are you decide where you want to let this AI go. And we call that the agenda that we give it, right? So then this is through prompting structures. So we give it an agenda. It's there to be like your engagement coach, but not a clinical coach, not yet, right? And so we're telling it, you're not to answer sort of hardcore clinical questions. What you can do is serve up pre-packaged, pre-approved by our clinical team pieces of clinical content, right? Now you still got to monitor that and make sure that things aren't getting through. We log it all, of course. We use a second model as like a guardrail to check and search for things that might slip through. And then ultimately, this is a probabilistic exercise, right? So then a lot of things in IT, let's call it broadly, in information systems, it's like, even though there are bugs or defects or whatever, they tended to be kind of binary, right? It either worked this way correctly or it didn't. And that's where AI is a little different because, literally what the LLMs are doing is a probabilistic based projection of what it needs to say to you next, right? Well, that sounds really scary, but if you look at other things in healthcare, a lot of how we validate, let's say clinical trials for drugs, they're probabilistic, right? You don't get a drug approved because it was perfect for every person and there were no side effects. It's actually a risk reward trade-off, right? First of all, it doesn't work for everybody. And for some people, there are side effects. And so what you're looking for is like a probabilistic model that says the rewards far outweigh the risks. And I believe that we're going to have to go there with some of these technologies to run them through, simulations and get to a level of certainty and, pick your number. It's 99.5% sure that it's not letting anything negative slip through, something like that, right? So we're not pretending that's all sorted out. I think we're all figuring that out together as humans, but I do strongly believe it's going to be that kind of a model, not absolute 100% certainty, but between the prompting and the guardrails and the human oversight and the evaluations, getting to, a probabilistic certainty that it's safe and effective.
Yeah. I'm developing an AI application right now that we're super excited about, and it's also kind of in a high stakes moment in time in a business's journey with proposals and sales, responding to RFPs, and so you can't get that stuff right. Some of those RFPs are worth millions and millions and millions of dollars.
Yeah, but then again, you could screw that up too, right? As a human.
Yeah, absolutely.
So,
that is part of kind of what we tell people is, a human can also mess this up. And actually,
right.
This artificial intelligence can pick up on things that a human might overlook.
That's right.
And so, you got to counter with, well, AI is better at these things and humans also do this. So it's a unique time to be building technology, and it's super exciting, kind of where you all have positioned yourself with two of these rapidly emerging massive industries in VR and AR, but also artificial intelligence. So excited to keep watching you all thrive and grow and evolve. Now, we always love to transition back to Kentucky. You and I are from, I don't know if you remember this, I'm also from Elizabethtown. There's something in the water in Elizabethtown because, you've got so many amazing people that have come out of there. I'm sure you also work with Doug Smith through Doug Smith and at Microsoft, and he's deep in the weeds of AI there, and John Wilmoth and the Bowers. And, there's so many great people that have come up through our entrepreneurial ecosystem and technology ecosystem through Elizabethtown. And so it's unique that you're there. Do you think there's something in the water, or what is it about E-Town?
That's a great question. I don't know. I think it's sort of heaven on earth down here. I got to tell you, I love E-Town. Been here most of my life. We're close enough to Louisville to get everything Louisville has, but maybe just a tick or two easier life, slower path. I don't know. Just a great place to be.
Yeah. So I'm curious, one of the issues in Wednesday of this week, we were at a backed by Kentucky event for funding in the state of Kentucky and venture capital. Give us a sense of how you capitalized this business and Kentucky's involvement in that, and maybe how you had to go outside of Kentucky because we didn't have resources here. So talk a bit about your experience, growing and funding a business here in our state.
Sure. I mean, the Kentucky roots are deep. First of all, without all of my great years at Humana, I probably wouldn't have, I wouldn't have known how to do this business, right? Or built the personal capital to found it. I bootstrapped for a couple of years, heavily influenced by my opportunities at Humana. And then when I did go out to raise money, my first couple of rounds, I did 2 rounds of convertible notes back in like 2018, 2019. Almost everybody was from Kentucky and or Louisville, literally. And I hope I don't forget anybody, but David Jones has been amazing, 3-time investor. Matt Thornton Capital, 2 or 3 times, I think. Larry Benz and Confluent Health, Max Schwab, Future Labs Capital, Kelby Price and KSTC. They were really instrumental early on. I think, I think that's now Keyhorse. I'm not sure if KSTC and Keyhorse are exactly the same thing, but Kelby was great. John Wilmoth was literally my very first check, other than, for myself. Elliot and Elizabeth Rounceville, Phoebe Wood. I hope I'm not forgetting anybody, but at one point I remember doing the math, way back, and it was like 80% of all my capital came from Kentucky and mostly Louisville. And while this wasn't capital directly, Endeavor Louisville, Jackson Andrews, and I became an Endeavor entrepreneur in 2019, just so early. I mean, I had no idea what I was doing on so many levels, and being part of Endeavor before I was even accepted as an EE, Jackson connected me with so many smart people that were ahead of me. Kyle Green at Handle Global, and Stacy Griggs at El Toro, and Ankur Gopal with Interapt. And, so you being able to talk to other founders and just getting guidance, particularly in those early days when the learning curve is so steep, was tremendous. So, now I've had others. Senator Bill Frist in Nashville has been a huge help and investor. And then as we've matured, we brought in more traditional, Optum Ventures and Oxford Science Enterprises and Sumitomo Pharma of Japan and Grunenthal and Accenture Ventures, and I'm probably forgetting some. But I don't think we ever would have gotten to those rounds and those sort of more global things without, all the help and support out of Kentucky. So, hopefully I'll be in a position to do that for others at some point, be the next Matt Thornton or David Jones, but a long way from that. But yeah, it's been tremendous.
That's awesome. Love to hear that a lot of your capital has come from Kentucky, which is, I think that just speaks to the experience that you got at Humana during your time there, and kind of the personal capital that you were able to build up. Oftentimes it's just, you hear entrepreneurs trying to get started off when they're, maybe mine or Evan's age. It's a lot harder to do that just because of kind of the culture of risk tolerance here in the state.
Yeah. I wouldn't say, Humana, fantastic. I didn't learn about entrepreneurship at Humana particularly. I learned about healthcare. Right. And so it's a very different world. Getting outside of Humana actually was when my network sort of got way more diverse and exploded with all these people I'm talking about. And that was a very different world. And, I can see now why investors prefer 2nd or 3rd time founders, because first time, man, it's so hard. It's kind of a miracle we're still here. But, with all that support, we are. So.
That's awesome. Well, before we let you go, we just want to give you a chance to tell people where they can learn more about RealizedCare, any sort of social media channels they should follow, or website, anything like that.
Yeah, I'd say just start with our website, realizedcare.com. We post a lot on LinkedIn as well. We are a B2B business, so we don't do a lot in consumer channels of, TikTok or Facebook or Instagram. We've done a little bit, but, we're mostly, X, LinkedIn. Website is a really good place to start. And, we just, if you're looking for kind of digital care management and population health support, we'd love to talk to you.
Awesome. Well, Aaron, it was great catching up. Congrats on all the success to this point. And we're excited to keep following along and watch you guys transform the space. So awesome. It's been great talking.
Let's do episode 450 or something. Okay.
For sure. Hey, we're going to be here that long. So
very good.
That's awesome. All right. Talk to you soon.
Thanks, guys.
See you, Aaron.